Have you ever wondered, is my child developing differently? Could it be autism? If you are noticing unique behavior or if your instinct tells you something is a little different, you are not alone. I'm Dr. Yang, and today we're diving into early signs of autism spectrum disorder or ASD and powerful self-assessment tools that help you better understand your child's development. I will also share some integrative therapies that offer here at the Young Institute which can support children on autism spectrum. So stay with me because early action can make a world of difference. Before we get started, don't forget to subscribe and hit the bell icon so you will stay updated on important topics like this. And if you find this video helpful, give it a thumbs up and share with other patients for these resources. Let's start with a quick overview. Autism spectrum disorder is a developmental condition that can impact social skills, communication, and behavior. It's called a spectrum because the way it affects each child can vary widely. Some children show noticeable signs early, while others may have more subtle symptoms that emerge over time. Parents often wonder what to look for, so here are some common signs of ASD that you might notice in your child. First and foremost is the social interaction challenges. Many children with ASD may find it difficult to make eye contact or respond to their name. They might prefer solo play over group activities. Second, communication differences. You may notice delayed speech development or repetitive language. And some children may struggle with back and forth conversations. Number 3, repetitive behavior and routines. Repetitive actions like hand flapping or strong need for routines are also common. Changes in routines can be distressing to them. Number 4, sensory sensitivity. Some children with ASD may be highly sensitive to certain sounds, texture, and lights. Now, these are just a few examples, and remember, every child is unique. But if you're noticing these behaviors, self-assessment tools are a great way to start understanding more about your child's development. Let's go through some self-assessment tools for parents that provide a clear picture of your child's development. These are not diagnostic tools, but they can guide you in knowing if you should seek further evaluation. Tool number 1 is the modified checklist for autism in toddlers, revised. It's designed for kids 16 to 30 months old. It's a quick yes-no questionnaire, and if certain patterns emerge, it could be a sign to consult with a healthcare provider. You can access it for free at mchatscreen.com. Tool number 2, social communication questionnaire. For children over 4, the social communication questionnaire, SCQ, focuses on social skills and repetitive behaviors, helping parents identify patterns. It's available through licensed providers. Tool 3, Childhood Autism Spectrum Test. CAST is for children age 4 to 11 and includes questions on social and communication behaviors, providing insights on traits associated with autism. Number 4, Autism Spectrum Screening Questionnaire, ASSQ. The ASSQ is for children aged 6 to 17 and is excellent for spotting mild or high-functioning autism traits. It's helpful if your child has subtle symptoms that might otherwise go unnoticed. Number 5, Ages and Stages Questionnaire, Social Emotional. The ASQ is a social emotional tool that assesses development from 1 month to 6 years. It's available through many pediatricians and early intervention programs. 2.6. Vanderbilt Assessment Scale. Finally, the Vanderbilt Assessment Scale is often used for ADHD but includes social and communication skills. This can be a great complementary tool. So, how should you use these tools? Here are a few tips. Number 1, combine tools. Sometimes using more or 3 tools together gives a fuller picture. Number 2, observe over time. Regularly noting your child's behavior in various settings help paint a clearer picture. Number 3, consult your pediatrician. While these tools are helpful, talking to a pediatrician or specialist is essential for further guidance. At the Young Institute, we offer integrative therapies that can support children who have been diagnosed with autism spectrum disorder or are experiencing developmental challenges. Let me introduce a few therapies that could make a positive difference for your child. Advanced nutrient therapy focuses on correcting biochemical imbalance that might contribute to behavioral and emotional challenges. By adjusting nutrients like vitamins, minerals, and amino acids, we work to support optimal brain health. This therapy can be beneficial for managing mood, focus, and overall cognitive function. We also offer QEEG-guided neurofeedback. QEEG, or quantitative electroencephalograph, maps brainwaves activity, allowing us to identify areas that might need support. Neurofeedback then uses this information to train the brain, help to improve focus, emotional regulation, and behavior. Neurofeedback can be especially useful for children with ASD, and it helps them build self-regulation skills. Our gut-brain access care approach recognizes a strong connection between gut health and brain function. Research has shown that imbalance in the gut can impact behavior, mood, and even cognition. We focus on nutritional support and gut health to optimize overall wellness. Antioxidation and regenerative therapy. Finally, we offer antioxidant and regenerative therapies aimed at reducing oxidative stress and promoting cellular repairs. These therapies, including hydrogen molecular therapy and exosome therapy, can support the brain's natural healing process and improve overall energy and resilience, which are often helpful for children facing developmental challenges. Our goal at the Young Institute is to provide a holistic approach to support each child's unique needs, combining science and integrative medicine to promote wellness. These therapies aren't a one-size-fits-all solution, but are tailored to help each child thrive. If you're considering an evaluation for your child, or if you are curious about these integrative therapies, reach out to us at the Young Institute. We're here to guide you every step of the way, whether through early assessment, personalized therapies, or simply answering your questions. And if you found today's video helpful, please remember to subscribe, give it a thumbs up, and share it with other parents who might benefit. Feel free to leave your comments or questions below. Thank you for watching and take care.